afternoon, everyone. Myself, Dr. Kirti, Assistant Professor, Physiotherapy Department. Today, I'm going to tell you about the fracture of clavicle. So, here we are having the clavicle bone, also known as collarbone. So, usually the fracture occurs in the medial part, in the middle third of the bone. And usually it occurs due to fall on the outstretched hand or due to direct trauma to the bone. So, usually the fracture can be managed conservatively or surgically. So, usually there are two fragments, lateral and medial fragment. The lateral fragment is pulled downward and forward due to the weight of this limb, and the middle fragment is usually pulled upward due to this SCM muscle, that is sternocleidomastoid muscle. So, in case of undisplaced fracture, it is usually managed with the triangular sling or the figure of 8 bandage. And usually the fracture heals within the span of the 3 weeks. So there are two approaches. First, I'm going to tell you about the conservative approach. So if the fracture is undisplaced, or we can say it is minimally displaced, usually it is managed conservatively. So what physiotherapy approach we can do in that case? So first of all, it is very important that during the immobilization phase, that is during the period of 3 weeks, it is very important to check the sling. Either it is compressing the axilla or the compressing other vessels. And after the immobilization period, means after 3 weeks, the mobilization period or phase starts. So in that period, we can start with the relaxed passive movement. So how we can do that relaxed passive movement? So this shoulder movements like flexion, then abduction, and then extension. You can do internal, external rotation. But these movements should not be performed actively initially, but by the therapist in the supine position. So next, what we can do, Codman or pendular exercises. So what are the Codman or pendular exercises? Like you have to lean forward like this, and then this is the first exercise. You can repeat it 8 to 10 times. Then the second exercise would be this, and third would be like this. Fourth would be like this. Now, the next exercise which we can do with the help of dumbbell or the weight cuff, it provides resistance to the muscle, so it helps in strengthening the shoulder girdle muscles. Shoulder girdle include the glenohumeral, your sternoclavicular, acromioclavicular, scapulothoracic joint. So, with the help of weight cuff or dumbbell, we can do these exercises like this. You can repeat each movement 8 to 10 times like this. In the supine position, first initially, then you can in the you can progress to standing position, then progressively you can increase the weight. So usually the shoulder or the joint is usually mobilized uh, within 6 weeks.